Hi to you, Mama Aya. I will be explaining the two disorders in the nervous system that I chose, the disinhibited social engagement disorder or DSED and acute stress disorder or ASD. Disinhibited social engagement disorder, or in its acronym DSED. So, what is DSED? In accordance with Dr. Holly Schiff, a licensed clinical psychologist based in Greenwich, DSED is a childhood attachment disorder that makes it difficult for children to form an emotional, stable, and meaningful bond with others. The characteristics of this disorder: it is a behavioral disorder in our nervous system that occurs in young children. It is an attachment disorder that makes it hard for children to form an emotional bond with others. But you may notice that children with DSED can easily talk to strangers and mingle with them. In other words, explains Dr. John DeGarmo, an author, foster parent, and founder and director of the Foster Care Institute, there is no sense of stranger danger in a child who has DSED. Children as young as 9 months old can develop signs for DSED. If a child shows even two of the following symptoms, they may have DSED. And these are the symptoms of DSED. They are not shy or scared but excited when they meet strangers or unknown people. They are extremely friendly, chatty, or physically close with strangers. They behave in a socially unacceptable manner according to social norms. They leave a safe space and go away with a stranger. They don't ask their caregiver or hesitate before going away with a stranger. They are impulsive and socially disinhibited. They have not been cared for adequately or have a history of trauma or abuse. Children with DSED have severe difficulty in forming warm, affectionate, or close bonds with other children or adults. If DSED goes undiagnosed, it is associated with the following issues later in life: emerging personality disorders like borderline personality disorder, behavioral disorders like attention deficit hyperactivity disorder or ADHD, drug addiction, and substance abuse. Note: remember that not all children who are friendly with strangers have DSED. They may naturally outgoing and talkative with others. However, they will seek their caregiver's approval for their safety at all times. If diagnosed with DSED, the child will be given all the care they need through a specific treatment plan. This will help the child overcome negative experiences and grow up to form meaningful relationships with their parents and others. DSED treatment involves the entire family so that the child can bond with their caregivers. Treatment can include the following therapies, depending on the child's age: talk therapy, play therapy with toys and games, art therapy. Before treatment can begin, children with DSED must be placed in the care of the stable caregivers. So, if the child is in foster care, for example, treatment will begin once they are placed with someone who is committed to their long-term care. This is because treatment for DSED usually involves family therapy. DSED treatment involves the entire family as it is important that the child can bond with their caregivers, explains Dr. Schiff. The therapy would also help the caregivers learn how to best interact with their children to care for them and support them to strengthen the bond. Acute stress disorder or ASD. So what is ASD? According to Roy H. Lubit, MD, PhD, acute stress disorder or ASD is an intense and unpleasant reaction that develops in the weeks following a traumatic event. Symptoms typically last for 1 month or less. A person who has experienced or witnessed a life-threatening, terrifying, or otherwise deeply traumatic event may, in some cases, develop acute stress disorder or ASD, sometimes also called acute stress reaction. People who are affected by ASD tend to experience extreme feelings of terror and helplessness in reaction to the trauma and may develop psychological and physical symptoms. The physical symptoms are typically caused by stress hormones such as adrenaline and an overactivity of the nervous system. They may include palpitations, difficulty breathing, chest pain, headache, stomach pain, nausea, and sweating. Also, for the psychological symptoms of acute stress disorder include arousal, hypervigilance, an inability to focus, sleep disturbances and angry outbursts, avoidance, Determination to avoid memories, people, feelings, or places associated with the trauma. Dissociation, a sense of physical displacement. For example, seeing oneself from outside one's body, feeling dazed, experiencing an altered perception of time, difficulty remembering the event. Intrusion, recurrent, involuntary flashbacks of the event, nightmares about the event. A healthcare professional will work closely with a person to develop a treatment plan that meets their individual needs. Treatment for ASD focuses on reducing symptoms, improving coping mechanisms, and preventing PTSD. Treatment options for ASD may include cognitive behavioral therapy or CBT. Doctors usually recommend CBT as the first line treatment for people with ASD. CBT involves working with a trained mental health professional to develop effective coping strategies. Mindfulness. Mindfulness based interventions teach techniques for managing stress and anxiety. These can include meditation and breathing exercises. Medications. A healthcare professional may prescribe antidepressants or anticonvulsants to help treat a person's symptoms.